So I was asked why I ended up having C1-C2 fusion and I didn't do regenerative medicine for my Atlantoaxial instability. I just want to start by saying that from my understanding, it is definitely more accessible to treat cranial-cervical instability that is lower down, so C2, 3, 3, 4, and downward, because of the access points and how those ligament structures work. I have instability through those parts of my neck and stenosis at C4, 5, and I would consider regenerative therapy down the road once I'm further along and if I still have enough symptoms and I have some needs. However, based on the advice of the doctor who diagnosed me and the people supporting me and where I was at, I was not advised to do regenerative medicine. My understanding is some of it was the particulars of my case, so how my C1-2 was impacted, the damage to those structures, the fact that they were all involved. I don't believe I was able to be aligned safely, so my understanding is that it's very complex to access all the ligament structures for C1-2. You need to, I think it's only one specialized clinic that does that. You need to go through the throat, but you also need to be able to be aligned, and I think in my case that was not an option. I also, the level of neurological symptoms I was having became quite severe and had, I mean, they were always really hard. They were always completely life-limiting. That did progress over time, but the type of symptoms were not safe. So, you know, the way paralysis would affect me, that I would get locked in. So I would have times where my body would, I could not connect with my body. I couldn't tell my hands to move. I couldn't make myself swallow. I couldn't call out saying I need help or help me change my position. And those types of things did play a huge role. Recognizing that regenerative medicine and less invasive measures still do stir up the system. And I'd been at a point where, you know, working with my ongoing care team, you know, months prior, they had to stop treating me. My body became so hyper-reactive that treatments that helped kept me going, now that my system was so sensitized, just flared me up more. And none of those treatments were wrong. They had worked for me for such a long time. And so from research and also talking in depth to other patients who'd end up having fusion, I kind of made my choices based on all of the information I just mentioned. I do want to say that if a person is advised and is a good candidate and has the opportunity, I personally, if it were me, would do regenerative medicine first. I would do anything non-surgically. There's also nemoreceptive tonus techniques that a lot of people do, treating the inner two most autonomic muscle groups so that they can kind of reset and you can get that alignment back that is lost when you have instability and there's that slippage. I would do all of those things if I had the opportunity, but for me that wasn't an option by the time I was diagnosed. But also I don't know if it would have been given the severity of my accident and the severity of ligament tearing and how much was involved. And in hindsight, I feel really strongly that in my case, surgery was the right choice. I'm aware of the fact that it is a completely permanent change in my structure, that down the road there may be things about it that you know, can adjacent segment challenges and whatnot. But for me, it not only saved my life because I was aware of how severely sick I was getting towards the end, with symptoms not being safe, that, you know, I had a finite amount of time. I could sense that in my body. I could watch how my body was changing. I could watch how, yeah, it was pretty intense. But I was most afraid of losing that last bit of function. And I was so aware that the things that kept me going, like I was losing my ability to do the slightest things. I was losing my ability to move around, get out of bed, and even just access my sight and my mind. And I recognized that my time was limited and that this was the right choice for me. I'm very, very lucky that I came out of surgery with less neurological deficits. So I went into surgery with paralysis, unable to hold my body weight under my legs and whatnot. And I came out better. I still have a lot of healing to do. So I still have a lot of kind of neurological healing. So a lot of brain injury symptoms, brain fog. I have a lot of visual symptoms. But I'm getting stronger and stronger, and I'm doing better and better. My brain doesn't feel like it's starving. And I'm making milestones in my physical therapy again. I'm able to be treated again. But yeah, here I'll show you. So because I have instability through my whole cervical spine and stenosis, and there was a lot of years of adaptation, my neck really did change. And for me, I didn't get loose. I got tighter and tighter and tighter. So movement was really difficult. But through surgery, creating that opportunity, and now physical therapy, so I can move my head up and down. Prior to surgery, actually for several years, if I had had my head up, I would have dropped to the ground. And it's definitely tight, and it's definitely a little bit, if I push it too far, I feel a little bit lightheaded, but that's been progressing, that's getting better. So on a gentle day, that's kind of movement. It's something I actually work with every day. We do a little bit of vestibular, so you watch something with your eyes and then move your head, but I'm really grateful. I have more range now than I did prior because movement caused me to, drop, or my legs not to be connected, or the locking in, and now I can do that, and I can still feel my hands and move my feet. We need to talk about CCI.